The day after final passage of the Obama health care reform plan, the fight is not yet final. 24-hour News 8 Suzanne Jihan joining us live at the live desk here with the latest out of Capitol Hill after yesterday's historic vote.
Brian, Democrats and their allies are trying to get Americans to feel positive about this health care vote. Republicans are saying they're going to keep up the fight. The president is set to kick off a campaign to sell reform as a big win for everyday Americans. His plan phases in gradually. Within 3 months, people with no insurance because of pre-existing conditions will be able to buy insurance through a pool. In 6 months, the bill would bar lifetime caps and would require insurers to allow young people to stay on their parents' policies until they turn 26. In 3 years, higher taxes kick in for well-off families to help pay for this health care plan. And by 2014, the plan will subsidize needy families buying coverage, require employers to cover employees, and mandate that every American be insured. Despite the passage, many Republicans are still opposed, and they're saying they're going to keep fighting.
Democrats may have won their vote last night, but they lost the argument, and they've lost the trust of the American people.
President Obama says he plans to sign this bill into law tomorrow. Once it is signed, health care reform can be modified. The so-called reconciliation fight is going to be taken up next week in the U.S. Senate. Back to you.
Now that health care reform, as championed by President Obama, is about to become the law of the land, there are a lot of questions about just what that means for you. On our Facebook page, people have been weighing in with their thoughts, and 24-hour News 8 political reporter Rick Albin has been trying to track down some of those answers. A lot of response out there.
And it's tough because just of what Susie was talking about, this bill is not done. It's not done by a long shot. The fix has to be made. The rule has to be written. The commissions have to be established. But let's start with what we think we do know. Health care reform, as defined by the Democratic majority, will become law as early as tomorrow. But that does not mean there's unanimity as to what it all means. With the slimmest of margins, the bill passed. No Republicans supported the measure. More than 36 Democrats opted to vote no, too. So the answer to many questions about health care reform depends entirely on who you ask. There are some things that seem marginally certain, at least for now. For example, Frank asked, what will be the consequences for people who can't afford insurance but make too much to get Medicaid? Well, according to an analysis from the Kaiser Family Foundation, families and individuals making up to 133% of the federal poverty level will be enrolled in Medicaid, no cost. Those above that mark will pay only a small percentage of the overall cost, from around 3% of their annual income up to 9.5% of their annual income. That's for people making up to 400% of the poverty level. To give you an idea what that is, current poverty level for a family of 4 is $22,000 a year. It's well to note that this provision of the bill, if fully implemented, will not go into effect until 2013, which brings us to another question. This one from Jen. She wants to know, how soon can I get my self-employed husband insured? It's too expensive right now. I hope this helps. Well, again, most of the subsidies will not kick in until 2013, but then the same provision would apply as above in the terms of income. Small businesses with 10 or fewer employees and annual wages of less than $25,000 would receive tax credits up to 50% of an employer contribution, though it does not specifically talk about self-employed individuals in that provision. Again, all of this information is based on assumptions of the majority Democrats who passed the legislation and assuming that all of the so-called fixes are moved by the Senate. There are still hundreds of unanswered questions about how the bill will be interpreted, what changes could be made before some of the implementation dates. But as of right now, timeline for the two questions above seems to be about 2013. Coming up at 6, more questions, hopefully some more answers, and you can join us at the Wood TV Facebook page to ask your questions.